2009, that's what America's healthcare bill was, $2.53 trillion. Now, $1 trillion is actually a lot of money. You see, 1 million seconds ago was Monday of last week, 8 days ago. 1 billion seconds ago was mid-1974, August of 1974, about the time Richard Nixon resigned. 1 trillion seconds ago was 30,000 years before the Christian era, 30,000 BC. $2.53 trillion on healthcare. The U.S. spent $1.1 trillion on food. All personal consumption in a slightly larger country than ours, China, was $1.4 trillion. Healthcare in 2009 at $2.53 trillion was 17.3 cents out of every dollar spent in the United States. And that's the problem, you see. Other countries, Israel, Switzerland, Sweden, Norway, they're stuck at between 9. The highs don't get to 12. There's some 11.8% out there. We're at over 17%, and at current rates of growth, we're going to be 25% by 2025. For folks who don't like healthcare reform, I got bad news for them. There will be healthcare reform when our economy collapses under the weight of healthcare. Actually, if the continued growth rate goes, let me give you an idea, by 2040, half of every dollar in the United States spent will be healthcare. So it's got to change. This is one of my favorite graphs to show in a medical talk. It's from one of my favorite medical resources, the Central Intelligence Agency Fact Book. The blue dots here are per person healthcare costs, how much it costs to take care of a person in each country. And there are a bunch of countries at the bottom. I don't put them all here, but and then the red lines are life expectancy. And you can see Japan has, and San Marino and Monaco have the greatest life expectancies on the far left. The United States is actually, here they're 29th, but I edited some countries out. The United States is 50th in life expectancy. Cuba's 51st. Albania's 49th. We're in good company. We have the most expensive healthcare system on a per person basis, the most expensive healthcare system on a gross basis, 17%. Yet we don't get what we pay for. We pay more for medicine than anybody else, and we're 50th in life expectancy. Now, some people don't like using life expectancy. Let's look at a couple other ways of looking at it. I just put 2 other countries that we're frequently compared to because people love to bash the Canadian healthcare system. We don't do well in infant mortality. Actually, Cuba does better in infant mortality. White male life expectancy, we don't do better. And then, of course, per capita costs and proportion of gross domestic product. We have to realize that Medicare, Medicaid, and Social Security account for all the projected increases in federal spending over the next 40 years right now. OMB in their 4-year forecast does not have defense spending increasing. They don't have spending for anything increasing except Medicare, Medicaid, and Social Security. I already told you about the growth in GDP. Both projections assume that the current spending will continue until 2050. You see, we've got to get scientific. We must objectively define pertinent scientific questions that need to be addressed, and we need to define the pertinent questions by assessing epidemiology and clinical outcomes. We need to realize that in this country right now, some people consume too much health care, meaning unnecessary care is given, and
some of those people are harmed because they get too much. Some consume too little, and those people are harmed because they get too little. And we could actually decrease the waste and improve overall health in the United States if we actually appreciated the scientific method and started applying the scientific method. When I say applying the scientific method, please realize that in the United States there's a whole bunch of people who practice faith-based medicine. I have faith that this test is going to save lives from this cancer. I have faith that this treatment is going to save lives from this cancer. I have evidence I'm going to make money from it, but I have faith. Faith-based medicine is practiced by so many people who should be practicing evidence-based medicine. We have overconsumption of healthcare. There's a subtle form of corruption in the United States, in U.S. medicine, where we have the greedy feeding the gluttonous, greedy doctors, greedy healthcare systems, greedy drug companies, even greedy health insurers, feeding people who consume too much healthcare that they don't actually need. We've got irrational patterns of screening in lung cancer, now prostate cancer, breast, cervix. Cervix cancer, we were talking yesterday, about 4,000 women, that's an ACS statistic, about 4,000 women die every year from cervical cancer in the United States. A large number of women in the United States get a pap smear on an annual basis, despite the fact that all the major organizations, the ACS, the American College of Obstetrics and Gynecology, and others, now recommend that women who've had 3 annual normal pap smears get a pap smear every 3 years. We've got a whole bunch of women who said, no, I must have it every year. You see, of the 4,000 women who die every year from cervical cancer, you've got data to show that about half of them never had a pap smear, and 90+% of the other half didn't have a pap smear within 10 years of their diagnosis of cervical cancer. So here we have the disparity. You got people getting something every year, and the people who need to get it never get it. That's medicine in the United States. When we look at CTs and MRIs, by the way, I showed you data on outcomes in Canada versus the United States. On a per 100,000 basis, we have 5 times as many MRIs in the United States and 3 times as many CT scanners in the United States. It's fair to say that people in the United States don't necessarily live longer, but we sure as hell do a much better job taking pictures of them dying.